Hello, everyone, and thank you for joining. Good morning, good afternoon, good evening, depending on where you are. Warm welcome to all, and thank you so much for joining us for today's webinar on Women and Girls Choose Cash Assistance in GBV Case Management. First, maybe a few points of housekeeping. So this webinar will be recorded. The recording will be shared with all participants shortly after the webinar. The session will last 1 hour. And you can use the Q&A window throughout the session for any questions that you might have, and we will come to them at the end of the presentation. And now I'd like to quickly just go through the webinar agenda that you'll be seeing today. So we'll begin with a presentation of our panelists, our speakers, and our facilitators, followed by a brief overview of UNFPA's approach to gender-based violence, GBV, and cash and voucher assistance, CVA. And the bulk of today's webinar will be spent on our country experience panel with country colleagues from 5 countries. And after the panel, we will highlight questions from the Q&A. I'll start with the presentation of facilitators. I'm Joanna Friedman. I'm the Global CVA Specialist for UNFPA based in our humanitarian office in Geneva. Today we have with us facilitating the webinar GBV and CVA colleagues from Geneva, New York, the Middle East, and Asia. And we'd like to thank the GBV AOR for helping us to organize and administer this webinar. And then for our panelist speakers, we have Pamela Di Camillo, our GBV program specialist from Jordan, Reem Khamis, our GBV program specialist from the Turkey cross-border operation in Northwest Syria, Taysir Dorsen, CVA coordinator in Lebanon, Rio Otara, our youth gender GBV program officer in the Philippines, Erika Garcia Roa, the Humanitarian Response Coordinator in Colombia, and Erica Talentino, our Humanitarian GBV Coordinator in the Lebanon Country Office. So really a huge thanks to our country colleagues for joining today and for sharing their experience. So I'd like to start out passing over to our colleague Alex Robinson, the GBV Technical Advisor in UNFPA's Gender and Human Rights Branch Technical Division in New York, to say a few words about UNFPA's global approach to gender-based violence and cash and voucher assistance. Thanks, Alex, over to you.
Thanks so much, Joanna, and thank you very much for having me this morning. It's really exciting to be part of an event on cash and voucher assistance. So as Joanna said, my name's Alex Robinson, and I'm the Gender-Based Violence Advisor in our technical division in our headquarters office for UNFPA. I think, you know, just to provide some overarching reflections on cash and voucher assistance across our UNFPA program areas. Accelerating reduction of GBV is one of 3 transformative results for UNFPA recognised by our recently endorsed strategic plan from 2022 to 25. And this is going to be achieved through a number of outputs, including through law and accountability mechanisms, quality and coverage of services, social and gender norm change, and doing this across all of our settings, humanitarian, peace and development. And cash and voucher assistance, or CVA, is one such mechanism through which UNFPA is working to reduce GBV across these output areas. It serves to increase the agency of women and girls, which sits at the heart of what we do in reducing GBV. And it's really wonderful today to see so many different countries presenting on what they're doing in terms of using CVA to achieve exactly this. And CVA has increased exponentially in humanitarian settings, from simple out-of-pocket expenses integrated into the budgets for GBV delivery, service delivery partners, to entire schemes of operation, including the integration of CVA into GBV case management systems. So at no time across the increase in use of CVA has it been used as a standalone program. It is a tool, it is a vehicle through which we increase the agency of women and girls to reduce GBV. And it needs to be integrated into the programs we support across that humanitarian peace and development context. While we witness case management systems progress from localized humanitarian responses to long-term systems in a development context, we also work to continue to support CVA as part of that adaptation process. And a systemic approach to the integration of CVA, therefore, not only serves to support individual women and girls as context change, but also to support and strengthen those social protection systems. Understanding and enabling the means through which CVA has been used in these humanitarian contexts to increase women and girls' agency can be used to contribute to social protection systems which really have the power to transform that gender equality landscape. And social protection systems can support increased individual, community, and systems-based resilience. And that is strengthening these social protection systems through the use of CVA to reduce GBV can lead to greater resilience to exogenous shocks, as well as decreasing the vulnerability of marginalised groups. So relying upon our expertise in working across the nexus, UNFPA continues to be uniquely positioned to continue to drive this work forward. And thank you for the opportunity to be with you today. And I now hand back to you, Joanna.
Thanks so much, Alex. So Alex mentioned our systemic approach to CVA within UNFPA, and I just want to reiterate that for UNFPA, cash assistance is a means and an entry point to contribute to gender-based violence response and prevention, sexual and reproductive health, including family planning, access to hygiene and menstrual hygiene items, and information and access to protection and health services. So we've seen, and the country colleagues on the line will describe today, how cash has really become a powerful tool for the effective and timely support within comprehensive GBV case management. Next slide, please. So just some examples here about how cash, when it becomes part of an individual's case action plan, is part of a coordinated follow-up to challenges that a survivor may be facing. So sometimes specialized services can come with a cost that can be a barrier for survivors, such as transport, legal, or specialized medical services. And cash is the tool that we can use to overcome those barriers. Emergency cash enables survivors to flee violent relationships. It is an alternative to institutionalized shelter, and cash over multiple months can help, for example, a woman to decide to flee and get back on her feet if she has left a partner who is hurting her. She can provide for her children while she finds income. So in this approach, survivors are the ones who choose how to use their cash. And it's important to note as well that the vast majority of women in our programs say that they felt safe receiving and using their cash. So cash and GBV case management is an approach that has initially been piloted in 5 countries: Jordan, Colombia, the Philippines, Northwest Syria, and Lebanon, but is now planned in several more. And we have the country colleagues on with us today on a panel to highlight how specific aspects of needs and eligibility, integration in the case action plan, the transfer amounts that they use, the delivery mechanisms, and the referrals from other GBV actors all contribute to this approach of cash assistance within GBV case management. So I now hand over to Elena to facilitate the panel with our country colleagues. Thank you.
Thank you, Joanna, and thank you, Alex, also for the great, for both of you for the great intro. So now we are going to hear directly from our colleagues in the country office, and we will start with our colleague Pamela in Jordan. Next, please. And talking about needs and eligibility for cash assistance. Next. So Pamela, you have supported survivor enrolled in case management with cash assistance for over a year now. What are the situations where you have seen cash as a potential to safely and effectively contribute to GBV risk mitigation and response?
Thanks, Elena. Good evening. Yes, indeed. It has been 1 year of program so far in different locations in urban area and the refugee camp in Jordan across different NGO. And what we see is that, you know, case managers develop an action plan driven by survivor needs and wishes, and review eligibility criteria to see if cash will be the tool or not to help women in their journey to safety and recovery. And we have seen a wide range of situations when cash has been provided to reduce GBV risks and consequences. Cash supports women when their current living arrangements are not guaranteeing safety to flee from the perpetrator, for example. They could be their husband, but could be also, in certain cases, the landlord, and harassing them or asking sex for rent. We had cases of survivors of IPV that we supported to ease their financial burden that was identified as the main factor increasing family tension and violence. We also use cash to support survivors with no economic needs to access urgent services. So as a part of the case management, maybe the survivors needs to access another services. Maybe she needs a cast because she has a broken arm because of the physical violence, or she needs to be represented in court. And so she needs a legal assistant and representation in court that, of course, has an high cost, or just transportation to reach a safer location and to reach her family support that in certain cases is out there. It's just a matter of get to a safer place.
Thank you, Pamela. And now we are moving to another continent. So, and Erika in Colombia. So for you is already the second year of Unfpa program in support to GBV survivors, so with cash assistance in 5 key departments. What are the immediate needs that cash is responding to? And how do you select the GBV survivors who receive cash in your context?
Elena, we have supported women and girls survivors of GBV in areas of the country that are affected by armed conflict or strong migration over the past 2 years. We are at CVA support for women at GBV high risk and with SRH critical needs the last year as a part of a comprehensive humanitarian response. Most often the needs are very immediate. It can be that the survivors need urgent medical attention due to the impact of the violence. It can be women that have to flee their home that need immediate support to not find themselves sleeping in the street or resorting to very negative coping mechanisms that need very basic items for them and their children. As a Moses, it is women who are coming to us with their children. Our GBV caseworkers are applying an eligibility criteria that looks risk level, whether cash transfer will be an appropriate modality to respond to the immediate needs. Also looking the vulnerability at whether the GBV survivor has resource of her own and whether she has support system around her or not. It is difficult as the needs are the direst.
Thank you, Erika. And then we move back to MENA, but with another Erika from Lebanon. So Erika, can you tell us about the inclusion of the LGBTQI+ survivors in the program and the challenges that you have faced and the mitigation measure that you have found? Over to you, Erika.
Thank you very much, Elena. Just checking in if you can hear me well. Okay. So yes, in Lebanon, LGBTQI+ individuals are among the most at risk of discrimination and also gender-based violence. So UNFPA has partnered with NGOs that provide a package of services and assistance to this group, and have a large experience working with the LGBTQI+ community. The package of services, which includes both health and psychosocial support services, this year we have also included the cash assistance. But from the very beginning, we have looked into some of the challenges that we could face working with this particular group. And one of the challenges that other organizations providing cash have faced, and we wanted to mitigate, were challenges related to the discrimination that LGBTQI+ individuals might face when they access assistance, including cash assistance, with like certain service providers. So some, for example, were refusing to provide cash assistance because of the appearance of certain individuals, especially transgender individuals. So we decided to try to mitigate those risks, and we did a sort of informal mapping of service providers that were supportive and sensitive to LGBTQI related issues, and they were not discriminatory. So we then, of course, always suggested to access assistance in these specific branches of banks, for example. And at the same time, we have set up some internal standard operating procedures to allow individuals to receive cash in hand when the risk of like accessing, for example, a bank or another financial service provider was too high. So to balance the financial accountability, but also with the safety and the well-being of the client. So we have tried to have different mitigation measure to continue to support this specific group. Thank you, Elena.
Thank you, Erika. And we stay with you to hear a bit more about how do you integrate the cash within the case management action plan. You have now 6 partners, and we would like to hear about how do you practically do that, and how do you include cash assistance process within the case management action plan steps.
Yes, thank you very much for the question. So basically, the cash assistance has been integrated in the case management process step by step. So from the partners that now are piloting, they're piloting the cash assistance within case management. They consider from the assessment phase or from the first phase of case management, they assess if cash is relevant to the specific case. For example, and also mentioning what also Pamela was saying before, if cash, for example, could help a specific need of the survivor. For example, if cash could be useful to pay for a service that is not provided for free, or for to pay, for example, for transport for a specific location that can be safer. And if the survivor doesn't have the cash to pay for the specific service. So a set of questions have been included in the assessment phase, so that caseworker can use to really understand if cash assistance is relevant to the specific survivor's needs. Then cash assistance, since the decisions around cash assistance has also been included in the case planning phase. So during the case plan, if during the assessment we have identified as cash as useful to support the specific survivors, then we decide if cash is still relevant and if there are not so many risks involved, and if those risks can be mitigated. For example, we ask survivors if they feel comfortable to go out to, for example, retrieve cash for an ITM, or if we need to find some solution to ensure that if we provide cash, cash is provided in a safe way. So, and if we decided that this is the case, then cash assistance become one of the actions in the case plan. So then in the next phases, in the follow-up phase, for example, we continue to check if cash has been used in the right way, if cash has been used in a safe way for survivors, and we connect basically the follow-up phase of the case management with the monitoring process that we will also discuss later in some other questions. And the same we do with the case evaluation. In the case evaluation phase, we actually consider if the cash assistance has been useful to achieve the case goal. And the case goal often is related to improve the well-being of the case, reduce the risk of GBV. So we really make sure that in the case evaluation, we looked into the outcome monitoring, which are also part of our monitoring plan. So basically, in each of the cases of case management, we include also the cash assistance component, from the assessment to the case planning to the follow-up to the case evaluation. And this becomes part of the normal case management, sort of like services that our partners provide.
Thank you, Erika. Thank you very much. And now we're going to dive a little bit more into the design of the actual cash assistance. And I like to, with the transfer amount and frequency. And I'd like to ask Pamela, what is the cash transfer set to cover in Jordan? And it is usually one-off transfer or a current cash transfer assistance. Over to you, Pamela.
Hello, Elena. Thank you. Can you hear me?
Yes, we can hear you.
Okay. Great. Yes, we have, of course, different situations. I just want to also mention that there are some situations in which the survivor is facing life-threatening issue related to an incident of GBV. And in this case, we have, of course, the case has a high priority, and we give an emergency cash assistance and emergency disbursement, of course, if the survivor has not access to other financial needs, because we really want to prevent further harm for her and her children. But the assistance can also apply to survivors that are not at immediate risk, but as decided within the action plan to remove from a violent and a risky situation. There can be, again, a violent relationship, but it can be also sexual harassment in the workplace, or it can be a situation of sexual harassment that we have a situation a lot in urban areas with the, again, with the landlord. And so depending by the situation in Jordan, eligible women receive either emergency one-off support, and this is based, the amount of this is based on the need, can be like the cost of the ticket to go from Amman to a city in the north, so it's a really small amount, or could be, for example, the fees to go to the court, that is much bigger. So it's this one, the one-off emergency depends really on the situation. And the amount is based on the case. When we looked at the recurrent cash assistance, that for us is only the 34% of our cases and goes between 3 and 6 months. In this case, what we did, we worked in collaboration with other agencies, and in particular with UNHCR, and we looked at the MAB, that it's the minimum expenditure basket. And basically, we took a percentage of the MAP that is based on the family size. So to give you a very concrete example, our average is a family of 5 members, including the survivors. So in this case, we will give to her something like $455 for a maximum of 6 months. But of course, this is on average. It depends on the family size, and it also depends on the situation. Sometimes it's a recurrent cash assistance, but the survivor has some family support, so she might not need all the amount, and we give her, of course, less. It really depends on the situation. If she's fleeing the relationship and she has no other support from family or any other network.
Thank you, Pamela. And I'd like to ask the same question to Erica in Colombia to see, looking at the cash transfer size and whether you use one-off or recurrent cash or both. Over to you, Erica.
The next slide, please. Well, in Colombia, our cash transfer, 54%, have been aimed at supporting immediate protection intervention to GBV survivors, covering relocation, payment of rent in places where the integrity of the survivors and their dependents is guaranteed. 12% have covered storage needs, such as safe abortion procedures, which are often consequence of sexual violence. 34% have covered mostly rent, food, transport to services, and livelihood to break cycles of violence associated with economic dependence, as this is what has been identified as the most critical for the women and girls at GBV high risk. We have aligned our transfer to the government set monthly cash transfer amount per person of $100. We are trying to provide recurrent transfer as soon as resources allow it at least 2 or 3 months, as we know it makes a much bigger difference for this woman.
Thank you, Erica, and allow me please to stay with you. And Luana, please, next slide. So we're still talking about design, and we'd like to hear more from you about the delivery mechanism that you're using and what is the setup for the actual disbursement of cash to GBV survivors. Over to you, Erica.
Thanks, Elena. We have contracted a financial service provider, a local remittance agency, which allows us to make a transfer within maximum 2 days to GBV survivors. It provides discretion as the survivor. They can retrieve the cash at any counter of their remittance agency, including in another municipality if needed. For the more urgent cases where the transfer needs to be available with hours, we have set up an emergency cash purse. Before that, our cash worker often had to take money out of their own pockets to respond to those cases. So we are glad we improved our internal process.
Thank you, Erica. And I think that your case managers are facing similar challenges that other case managers are facing across the other countries when they actually have to disburse cash from their pocket. So this is great. Thank you so much. So next, we are going to look briefly at some of the monitoring results that we are collecting in Lebanon. So let me hand over to pose the question to Taysir, our cash and voucher assistance coordinator in Lebanon, where they have developed a robust monitoring system that include post-distribution monitoring surveys and a complaint and feedback mechanism integrated with the GBV case management follow-up process that also Erica was talking about, and partners' existing hotlines. So Taysir, what are the key takeaways from the monitoring results looking at the GBV risks and protection outcomes?
Thank you, Elena. In fact, the integration of cash and voucher assistance into GBV programs and Unfpa Lebanon was a new piloted approach which required close monitoring to measure its contribution to the fulfillment of the protection outcomes and responding to the GBV risks and consequences. In general, and based on the PDM outcomes, a positive protection outcomes were indicated as a result of receiving cash assistance. But to be noted that the provision of cash was a part of holistic comprehensive programming that is based on providing cash and GBV services for the sake of improving the resilience and well-being of the survivors and allowing better potential to mitigate GBV risks. Some of the post-distribution monitoring results indicated that the emergency cash assistance had contributed to improved feeling of safety in terms of being able to cover the immediate needs for 75% of those assisted. And this percentage goes up to 84% for individuals assisted with recurrent cash assistance. In terms of decision-making and power dynamics, 84% of respondents considered that the cash assistance allowed them to be in a better position to take decisions. 85% of respondents stated that the assistance significantly mitigated their immediate exposure to GBV risks, and accordingly, 89% considered that the cash assistance contributed to the exposure mitigation of GBV incidents and risks, while the percentage reached 95% for the individuals that benefited from the recurrent cash. In relation to stress and tension reduction, 82% of the respondents considered that the cash assistance decreased the levels of stress, and the percentage reached 90% for the recurrent cash assistance beneficiaries. Can be highly linked to the reduced financial concern, especially in the times of economic deterioration like what was happening in Lebanon. 84% of respondents highlighted that the cash assistance enabled and encouraged them to access GBV response services, including case management. There was no incident or threat to safety as a result of receiving cash by all respondents, and 98% of the beneficiaries considered the collection of assistance from the financial service providers to be safe. We will try in UNFPA Lebanon to improve our monitoring tools in order to have better linkage to the protection outcomes. Over to you.
Thank you, Taysir, and thanks for all the great results and reporting. So we are building similar system in all the countries where we are implementing cash within GBV case management, and we are also conducting research with the Johns Hopkins University in different countries, and we will be publishing result soon. So thank you again, Taysir. And now we are next. So now we're moving also to a slightly different, same topic, but a slightly different approach. So how can we ensure the scale and how can we ensure the referral from other GBV actors? So Rim, our colleague in FPA Northwest Syria, has been integrating cash assistance also within the GBV case management through the establishment of case fund via its main partner, ISAN. However, UNFPA has also worked to ensure that cash assistance is made available for GBV survivor by establishing referrals between UNFPA partners and GBV actors who don't have the in-house capacity to provide cash. So Rim, can you tell us how UNFPA and its partner are supporting a survivor referred by other GBV case management actors?
Sure, thank you so much, Elena, for the question. Let me start by quickly giving a little bit of context. In the response of Turkey cross-border, we, as in UNFPA, we coordinate the GBV subcluster with currently 65 active member organizations, close to 90% of which are actually local Syrian NGOs. In our context, in the context of Northwest Syria, where we operate a number of essential services that are typically available in other contexts, such as safe shelter, is simply not available to GBV survivors. That's why cash has been identified as a key tool to respond to immediate and time-sensitive needs that are identified through the case management process, such as immediate safe accommodation arrangement or access to CMR or clinical management of rape. Since 2019, we've put a lot of efforts, and we try to expand the capacity of our GBV subcluster members so that they can scale up and they can use cash assistance for GBV case management. But for a number of different reasons that I'm not going to mention now, only a handful of those 65 member organizations have actually been able to integrate cash assistance in their GBV response. But the needs for the service persisted. Those few actors that were able to provide the service were basically mostly UNFPA partners. So we decided that we're going to expand the service. We're going to make it available to other GBV subcluster members through referrals to one of our implementing partner that you mentioned, Elena, Ihsan for Relief and Development. This was specifically as well introduced in support of high-risk cases that need response within 72 hours. And we've integrated these referrals in our recurrent GBV subcluster referral pathways, which has been extremely useful for member organizations who don't have the means to provide in-house cash assistance as part of their ongoing GBV response. If we move to the slide where, allow me to read a quote from Nidal, who is a GBV technical specialist working with one of our GBV subcluster members that operate in the northwest of Syria. She says, one of the toughest cases we're currently working with is a girl who's exposed to sexual violence by her cousin and her mother who's exposed to physical violence by her brother. With the cash assistance we received from UNFPA partner, we were able to provide them with a separate shelter option, furniture, and lighting. This referral provided a life-saving service to them. One key aspect in this collaboration is that our implementing partner provide the cash assistance to the field caseworker of the GBV subcluster member directly instead of the survivor herself. So the survivor does not have to deal with anyone else besides her own caseworker. And we've also made sure that we aligned, our documentation and our, practices for documentation of cash assistance. They're aligned with GBV guiding principles. So we basically had to walk the talk. So we just asked for a receipt form with the survivor's code on it and the signature of the caseworker who received the cash assistance. So absolutely no survivor identifiable data is collected. I just want to very quickly highlight that in parallel to this effort, we've also been working very closely with the cash working group here in country for 2 years now. We developed a joint referral SOP through a dedicated joint task force in order to facilitate referrals to cash working group actors for longer term and non-immediate cash assistance support of survivors. This coordination, I think, is quite important because we recognize that survivors in many instances require what our colleagues were talking about earlier, so recurrent cash assistance based on their needs, obviously. So beyond what we're able to cover in these internal referrals between GBV actors that I was talking about earlier.
Thank you, Reem. And so the approach that our colleagues in Northwest Syria are taking in terms of referral, we are also exploring how to replicate and scale up, of course, in other countries, also looking at the various memorandum of understanding we are having with our partners, but also the issue, as Reem was saying, about data protection and confidentiality for our beneficiaries. So next, please. Okay, so we are moving into also how we guide and how we support the beneficiaries and our survivor and with cash assistance. And we're gonna see from Erica, again in Colombia, and how to accompany recurrent cash assistance, case workers give a financial orientation to GBV survivors on expenses and on investing in micro livelihood activity. So can you tell us a little bit more on how this works and how this is a best practice for you? Over to you, Erica.
Thank you, Elena. The financial orientation helps GBV survivors understand that it is not so much money and that they should plan on how to spend it. We propose it that all of them who are interested. Then with some GBV survivors that receive up to 3 transfer and have some interest in finding a way to generate income, we propose support for the development of micro livelihood with further orientation. One about beneficiary told us, thank you so much. You don't know how much it helped me, as I didn't have anything to give to my kids. Thanks to you, tomorrow I can buy cakes, sell them, and generate income. Thank you.
Thank you, Erica. And you can see also the quote on the slide from our case management in Cucuta. Thank you again, Erica. So now we are changing continent again, but going into the Philippines with our colleague Rio, looking at the lesson learned for replication. Next. So in the Philippines, UNFPA and the office, you have been responding with the cash for GBV survivors in the wake of the various emergencies that you had to face. But you're now doing this again for the response to Super Typhoon Raiyodet. So what have you learned from your past experience and put into place that is helping you in the current response, Rio?
All right, thank you, Elena. In 2019 and 2020, UNFPA Philippines responded to damages and displacements in the southern part of the archipelago due to an earthquake, as well as displacement from conflict by providing unconditional cash for protection. It was provided to support victim survivors' healing process, covering their basic needs as well, and ensuring that they are able to access life-saving services and interventions. And this particular emergency was important. No, the response was an important step for us to really build our experience on responding to sudden onset emergencies with cash for GBV victim survivors. And one of the lessons learned is the importance of conducting post-distribution monitoring. And at the time, results showed that 90% of respondents reported that the cash modality was an appropriate modality for their needs. And currently, we are responding, as mentioned, to the Super Typhoon Rai, which hit several parts of the country in December 2021, with our comprehensive package of assistance for GBV victim survivors, which includes cash. And crucial, one of the lessons learned as well now is crucial to the implementation is having partners who have a strong connection on the ground and the experience as well on providing cash for protection. So we have implementing partners such as the Coalition Against Trafficking in Women. And through their efforts, we were able to cater to the needs of victim survivors of various forms of gender-based violence, including online sexual exploitation and abuse and human trafficking. And the cash for protection intervention is really closely coordinated and implemented with the local government and the local and regional social welfare and development office, which is the mandated government agency on GBV case management. And we work closely with this agency in identifying criteria on who is eligible to receive cash. And in the recent response, we looked at providing more recurrent assistance to GBV victim survivors, as covering assistance for several months for the same person can have more impact on the recovery. However, we also ensure effective cash programming by recalibrating strategies as needed, based on assessments on the changing needs of victim survivors as they move towards healing and recovery. So in this way, we are ensuring that as we are doing a survivor-centered approach to delivering cash intervention and really maximizing on the limited resources by ensuring the sustainability and positive impact to the lives of GBV victim survivors and other at-risk groups. Back to you, Elena. Thank you.
Thank you so much, Ri, also knowing how busy times are for you in this period, for taking the time to be with us. And thank you also for making the strong link also with the social protection, and the safety net and the government also policy, as Alex also mentioned into the opening of this webinar. So we finalized the question to our panelists from our end, and now I will hand over to Alice, who's actually going to summarize and propose some of the question coming from the audience to our panelists. Over to you, Alice.
Thank you so much, Elena, and thank you so much to our country speakers. That was really great. So we have maybe 10 minutes for questions now. And we've had many great questions coming through the Q&A box. So here I would like to start asking a question to Jordan, to Pamela, to know if you have received any feedback from survivors on whether they face any form of domestic violence or further harassment from their intimate partners because of the cash transfer. Over to you, Pamela, for this question, please.
Thank you. This is a very good question. We don't want to cause further harm, right? We are all here to prevent a response to GBV. So I think this is, I really like this question. And we, of course, we didn't want this to happen. So we built in our system when we were designing the program, we built in our a very strong post-distribution monitoring system, where actually we do have this question to the survivor. And we want to monitor, we want to make sure that this doesn't happen. And I want to share the good news that in 1 year of programming, none of the survivor reported that actually it increased the violence, but the contrary, what they are saying that providing cash contributed to reduce GBV. So there was not unintended consequences or increase in violence reported. But of course, we will continue to monitor, and I think this is a very important issue to take into consideration. I hope I addressed the question. Over to you, Alice. Thank you.
You did. Thank you so much, Pamela, and it's good to hear. So now maybe looking at the other questions that we have that came up from all of you participants. So we have a question that would go maybe for Reem, for Syria. So Reem, how do you ensure that the cash you provided reached families in difficult, or GBV survivors in difficult to reach places, particularly if we look at really areas like most affected by conflict, and what monitoring methods do you use? Over to you, Reem, for this question. Thank you.
Thanks for the question, Alice. I think cash assistance is a service of case management, as we've been talking earlier. So it follows more or less the same efforts that we do generally in our GBV programming to reach the most vulnerable. So we've tried to do so by providing GBV specialized services within the women and girl safe spaces that are our primary entry point, but also within, as integrated within health facilities, as well as through outreach. In terms of monitoring, we mostly use PDM, post-distribution monitoring, in the form of what we call client satisfaction survey, that is typically implemented twice, once 2 weeks after the delivery of service, and another time at the closure, at the case closure phase. The tools are harmonized and are part of our GBV Suppressor M&E toolkit that we've developed a couple of years ago. So all of our members have access to the same tool. And they're also part of the GBV IMS Plus or Primero that we've recently rolled out in our context. So this allows also to easily analyze data from the post-distribution monitoring.
Okay, great. Thank you so much, Reem, for this answer to our attendees. So moving on, there were so many questions. So moving on to another aspect of the work, I would like to go to Rio from the Philippines. Rio, if we can ask you a bit more on how you were organized in terms of process. So how the decision-making process is organized, how many people are involved in the decision to give the cash transfer to the GBV survivors. Have you assessed if there are any risks associated with this very specific power relation between the GBV survivors and the decision makers around the cash assistance? Over to you, Rio. Thank you.
All right, very important questions and challenging as well. Well, of course, firstly, before implementing the cash for protection, we do a risk assessment. So we conduct a risk assessment, which would include, all the risks associated with power relations included. No? Once this is conducted, it becomes a basis as well in the development of the guidelines on the implementation of the cash intervention. So in this guideline, of course, we outline the steps that needs to be done, who will be consulted, who are involved in the decision-making process. So in our experience, we usually have a representative from the Municipal Social Welfare and Development, again, the mandated government agency on GBV case management. We have case managers handling cases, representative as well of support groups from victim survivors themselves to bring voice to the decision-making processes. And also in some instances, local government. So what is also unique here is the integration of the prevention of sexual exploitation and abuse, or PSEA, in the development of in the orientation package for the GBV victim survivors. When we orient them on why cash is provided, what it is for, and if they experience power abuse, they can report to a specific hotline for PSEA. So that's it from our end, experience so far. Alice, back to you.
Okay, thank you, Rio, for describing also a bit of how that works on the process side. So now I would like, so we still have a few minutes. So maybe we have time for two more questions before we go to the concluding remarks. So now I would like to turn to Erica of Lebanon to answer, if possible, the question that came up from Chiara from the chat, who says, I understand that for people who experience domestic GBV, when they leave the home to get to a safe place, there can be a number of women who return home to their husbands or partner after some time. So then they go back to the abusers. Also this due, of course, to years of abuse, lack of confidence, power inequalities, and all these factors that we know of. So how would you monitor to see, or do you monitor to see how often women who go to a safe space return home? And if they do return back to this unsafe situation, how long does this tend to, after how long does this tend to happen, and what is the driver for this? So maybe mostly Erica, if you can also tell us, if you do monitor this, if women do go back to their home and the abusers. Over to you, Erica of Lebanon. Thank you.
Yes, thank you, Alice, and thank you very much for the question. This is really relevant. We definitely monitor this, and we monitor this beyond the cash assistance. It's part of the case management. So a survivor that decides to leave an abusive situation and go to a safe space, then continue to receive case management. So through the follow-up sessions with the survivors, then we monitor if the survivor decided to go back to an abusive situation. And in that case, perhaps we rediscuss also the cash assistance, because if the main decision-making process was related to the fact that the survivors wanted to leave an abusive situation, so the cash was used as part of this goal, probably in that case, if the survivors go back to an abusive husband, the case assistance is not relevant anymore. So the case management could continue, but perhaps we will have to rediscuss and reassess the situation and see what are the needs of the survivors in that case and what the case plan should change. So definitely we monitor that, and then we have to adapt to the new situation, and perhaps the cash is not relevant. But yes, to make it short, we monitor this component through the case management follow-up.
Okay, thank you, Erica. Yes, this is so important, and indeed it was a very important question. So maybe to finish this part on of open questions, and this will be fit this way, I hand over back to Joanna, our global advisor for CVA. So Joanna, if I can ask you a question that will be a great way to conclude. Is it UNFPA's perspective that cash should only be provided within a case management program? What if case management is poor and does not exist? So over to you, Joanna, to answer this one and provide the concluding remarks.
Thanks so much, Alice, and thank you to all the panelists. No, it's a good question. And so I would start by saying that UNFPA has a number of different types of cash and voucher assistance interventions as part of our GBV and also our sexual and reproductive health response and preparedness in emergencies. So today we're really focusing on our work in humanitarian settings and particularly on cash assistance within GBV case management, but we also have other types of cash and voucher assistance, ranging from cash and vouchers to support access to reproductive health, to family planning, to hygiene and menstrual hygiene items. And in all cases, as I mentioned in the very beginning, these are entry points for us to provide information for women and girls on services and GBV referral pathways. We also have other types of protection interventions where we utilize cash. So we have individual protection cash assistance in Northwest Syria, on which we have a case study that can be found on the CALP website and on the GBV AOR website. And we have a number of other CVA case studies as well that you can find on those two websites, and I'll come to the resources shortly. So this is not the only type of cash we do, but we really wanted to highlight some of the specifics of this approach today because we've had so many questions from partners and other actors in the GBV and CVA communities of practice. And UNFPA also works with its partners and in an interagency manner as well, of course, on building capacity for GBV case management more broadly. So again, if you're looking for some of the other cash-related case studies that we have, you can find them on the CALP website. So coming to, I think, our wrap-up slide now. Thank you. I want to say a big thank you to our panelists for taking the time today out of their busy schedules to give these very thoughtful and detailed responses to our questions from within UNFPA and also from all of the different colleagues and partners on the line. So thank you. And I wanted to just sort of describe where UNFPA is going with this approach in the future. As you've seen today, UNFPA is learning across countries and regions and adapting this approach as we speak with the women and girls we're serving, as we speak with case managers, as we speak with our local and international partners in the field. And we are also very much involved in the communities of practice around GBV and CVA as well. We're also conducting research on this approach with Johns Hopkins University, the Bloomberg School of Public Health Center for Humanitarian Health, which will be multi-country studies on our cash and voucher assistance, and that will cover cash within GBV case management, individual protection cash assistance, as well as cash within our sexual and reproductive health programming. So stay tuned for that. Preliminary findings along with some of our project monitoring results already show that cash could be an additional tool for all case management programs. That doesn't mean for all people and in all settings, but that means as an option. So we will continue to scale up and institutionalize cash assistance within GBV case management across UNFPA. We're also leveraging existing guidance to develop a very concrete internal how-to on using cash within GBV case management, using the approach from the beginning to the end of the case management cycle. And we've also adapted our internal financial procedures to ensure that emergency cash can be provided within 0 to 72 hours to GBV survivors in immediate need. We've listed here some resources. So we have a UNFPA Lebanon case study, which is already available on the CALP website, on the GBV AOR website, and the GBV guidelines website as well, depending on what your preferred community of practice is. And we will have a UNFPA multi-country case study on CVA within GBV case management, reflecting the learning that you heard here today, to be launched on CALP and the GBV AOR shortly following this webinar in the coming days. The first findings from our research with Johns Hopkins University will launch on CALP and the GBV AOR in spring 2022. And you can find our contact for our humanitarian office CVA team here if you have any follow-up questions. So thank you so much to everyone for joining us from many different time zones, and have a very good day or evening. Thank you. Bye-bye.